Good evening and happy Friday, Chicago. I'm Jerry Vasilatos. This is Chicago Corner. I am going to start up our banner that encourages you all to go sign the petition for Medicare for All, because this is a very special broadcast tonight. We had an amazing Medicare for All rally last month, thanks to the countless organizers and volunteers that put time and work organizing with national rallies across the country. So I thought it would be good tonight to have the organizer from the Medicare for All rally, Choe Bunton, join us, but also to update everybody on developments with how the Medicare for All organizers have teamed up with a group here in Chicago called the People's COVID-19 Response Network. And I want to tell you a little bit about the People's COVID-19 Response Network. They are a newly formed Chicago-based coalition fighting for the reconstruction of public health and the public sector generally on democratic and community-based foundations. The project argues that this approach is absolutely necessary if the woeful culture of the current U.S. response to the COVID-19 pandemic is to be abated. This new effort is anchored by public health and other service workers, teachers, rank and file union members, and community activists. It complements other vitally needed, primarily legislative work by coalitions like Right to Recovery, albeit with less support of well-established progressive unions, other organizations, and elected officials. With weekly national and Chicago Zoom conferences providing reliable information, People's COVID-19 Response creates a forum for a broad-based conversation about how people in communities and workplaces in Chicago and around the country are coping. These meetings have produced an initial setup of concrete demands which are expected to develop further as more people enter the conversation. The coalition aims to contribute to a groundswell of action for its evolving program. While Chicago-based, People's Response views the COVID-19 crisis as requiring nationwide and global communication, strategy development, and practical cooperation. In regards to the gutting of public health, over the last 30 years, Chicago's public health infrastructure has been gutted. Cost cutting and the outsourcing of public health responsibilities to nonprofits has produced a balkanized, fragmented system which made an effective immediate response to COVID-19 impossible. 4 decades ago, the administration of Harold Washington from 1983 through 1987 took seriously the development of a robust public health infrastructure. Since then, the gains made were undercut by Chicago Democratic mayors Richard M. Daley and Rahm Emanuel. They slashed the city's public health workforce from 2,000 in 1989 to 500 today, closed 53 clinics and facilities, and privatized all 7 comprehensive health centers. Now, keep in mind, this is a nationwide phenomenon with 100,000 U.S. public health workers lost in the last 40 years. They also tore down more public housing and closed more public schools than any other U.S. city while making major public transit cuts in African American and Latinx neighborhoods. Such policies pushed 250,000 African Americans out of the city and produced a grim calculus of racial disparity. Today, African Americans make up 29% of Chicago's population, but account for over 50% of known coronavirus infections and a staggering 70% of the ever-increasing deaths. For the last 3 months, mayors and governors from both political parties, while in some cases trying to quote-unquote step up, have in varying degrees aggravated the bottomless incompetence of the Trump administration's white nationalist response. They have failed to issue the comprehensive legal orders that would save lives and allowed social distancing and barriers to be haphazardly and ineffectively determined and enforced by individual businesses, hospitals, and public agencies. These officials failed to use their authority to set and implement a coherent program in a unified public health department in their states or cities. In the present moment, for all the vast amounts of widely disseminated information, some of it's excellent, some of it flawed, we rarely hear the words, quote unquote, public health infrastructure. Even on the left, there has been insufficient awareness of this need. There's far more awareness of the single-payer Medicare for all, while greatly needed, will not in itself provide the vital foundation of public health institutions. A thriving public health infrastructure is as necessary as air, food, and clothing. To be effective in Chicago, such a system must be firmly rooted in a large cadre of well-paid health workers from the city's Black and brown and poor communities. Let us imagine that as of December 2019, Chicago and other urban centers had constructed such systems, that they were ready with thousands of public health workers functioning in partnership with armies of community and workplace volunteers to combat any public health emergency, that these workers already had experience in strengthening environmental, land, occupational health protections. Such a partnership would certainly have won the trust and support of our communities. Imagine that the Corps of Public Health Workers and volunteers had, by December of 2019, organized effectively to accumulate the resources that would be needed to deal with the pandemic, which epidemiologists have long told us was inevitable. Imagine that Chicago had a nurse in every single public school every day of the school year. Had that kind of system been in place the minute a virus showed up in Chicago, a well-equipped, well-protected, masked, gloved, and suited-up public health corps would have gone into action. Door-to-door testing, contact tracing, and education on symptoms, modes of transmission, and social distancing would all have started immediately. People testing positive and or showing symptoms would have been referred to treatment right away. Cuba has had such a system, and people's response conferences have informed many people about their model. Can't it be done here? It can and must be if we're to collectively and individually survive. This is what the People's Response Network is about. I'm first going to join us in the live stream, Choe Bunton, and Choe was is a disabled activist and the local organizer in Chicago for the March for Medicare for All. I also want to introduce Dr. Howard Ehrman. Now, Dr. Ehrman has quite an impressive resume of credentials as he is involved in the People's Response Network. Dr. Ehrman was born on Chicago's South Side as the grandson of an Egyptian Moroccan Berber captured and enslaved in Europe, and 6 years old, who escaped at age 20 and taught him farming. Dr. Ehrman was a member of the original Rainbow Coalition in Chicago, working with Black Panther Health Minister Ronald Doc Satchel to coordinate the 9 organizations of the Chicago Free Clinic and Community Health Section. He was one of the organizers of AFSCME Illinois and Chicago State and City Workers in the 1960s and 1980s. Dr. Ehrman worked with others to build a union coalition of AFSCME, SEIU, Illinois Nurses Association, Teamsters, and the Doctors House Staff Association at Cook County Hospital. In 1975, he was elected to the contract and strike committees of the House Staff Association at County, which led a strike over patient care demands for 18 days, the longest doctor strike in U.S. history. He was also a co-founder of the Little Village Environmental Justice Organization in 1994, of Me Velita Neighbors in Little Village in 2019, and the People's Response Network in 2020. Dr. Ehrman has lived and worked in Little Village for 52 years and has 2 grandchildren in CPS schools. Now, lest you think that's enough, panel members, and obviously Dr. Ehrman's experience makes him well suited for his involvement with the People's Response Network. We also have somebody very affected by the COVID response in Chicago as it comes to our public schools. We have CPS mom and parent, Michelle Bautista. We also have Kathy Powers. We'll bring Kathy in here, who is a Northside Action for Justice board member and agitator, and I welcome that. Last but not least, we also have Chicago educator, and I hope I'm pronouncing this correct, and please correct me if I'm not. We have Choe, born in Seoul, grew up in Chicago most of her life, and is a recent member of the People's Response Network. This is quite a panel to discuss where we are with
love the cat
with healthcare in our country. The results of what may have moved forward since the Chicago and nationwide Medicare for All marches, as well as your alliance with the People's Response Network, which seems very, very well suited as a partner with all of their outreach to help the cause for Medicare for All, which even in the middle of a pandemic, our elected officials don't seem to think we need. Because, of course, why would we when the pharmaceutical companies and the insurance companies need to protect their bottom lines? Choe, let me start with you really quickly, because we did talk off the air, and I am going to involve everyone in this conversation. But I would like to find out, since the Medicare for All March last month, nationwide, what chatter or feedback you've gotten as far as different cities' movement forward with perhaps their local resources or organizations, as we have here in Chicago with the People's Response Network, to bang our elected officials over the head with a hammer over how important this is, when our elected officials and national media seem to just keep ignoring this.
Well, the only other local activity that I'm aware of, other than, well, Washington still has its state, Medicare for all that they're working on, and I know that California has CalCare, but Massachusetts also has its own state-based Medicare for all that they're trying to do on the state level, and we do have upcoming a week of action for Richard Neal, who's the chair of the Ways and Means Committee. So national is going to be targeting him, as well as the local, a lot of the Boston organizers. And they also have, I forgot to give you they have a petition where they're trying to work on the state level. But in terms of the national thing with Richard Neal, we're working on the graphics and all that good stuff. And we're going to planning to have like a tweet storm, possibly a town hall, and some action at his house. And it's going to be the week of, I think it's going to be from Saturday to Saturday, August 21st to 28th. And so those are the ones I'm aware of.
I recall from the petition website that there was going to be an initiative to petition the United Nations on behalf of the United States for Medicare for all. Is there any progress with that, or any developments with that moving forward that you know of?
Thank you for mentioning that. Yes, we are trying to get in touch with trying to find the right legal attorney or team, or someone pro bono who is well versed in terms of helping us prepare it with all the right legalese and everything. And so that's to my understanding, that's the stage we're in. I've reached out to a couple of groups here. I need to follow up with them to see if I can get any response here. I think we still plan on trying to reach out to see if possibly Code Pink or Amnesty International might possibly be interested. But yeah, that's still in the works in terms of getting the right legal advisors, counsel involved.
You'd think with all the high-powered attorneys in Chicago or across the U.S. that are scrambling for publicity, one of them would step forward, affirm, and say, hey, this is probably a worthwhile cause for us to get involved with advocating for. But hopefully, hey, if there are any of you out there watching the show, here's my pointing the right now. Here's the lady you need to get in touch with at Medicare for All in Chicago. Dr. Ehrman, how did the People's Response Network find the organizers for Medicare for All? Or Choe and Dr. Ehrman, can you tell us how the two of you, your organizations, your groups, met and realized what strength would come from such a strategic alliance? Because obviously the PRN was developed to respond to COVID in Chicago, but that's a major health issue that is related to what their mission statement was with providing health care for all.
Well, I'll just say how I discovered the People's Response Network to COVID-19, or AKA PRN. I found out about it through a fellow member of another group that I'm involved with called BWOP Chicago, which is Black Women Organizing for Power. And one of the co-chairs is Lynette Sims. I was hoping we could get her to join us, but unfortunately she had to work. But she had found out about it and told us about it. And we were like, well, yeah, we want to partner with them. That sounds great. And then I was like, volunteering and trying with outreach, and didn't know what I was doing, but I was starting to get more experience reaching out through that. And then when I wound up signing on to the Medicare for All March, I was like, well, these two should go together. I think, because I definitely think it's important to try and get more people locally involved, and in addition to the national aspect, but locally, that I think that's the key to moving the needle in terms of this action, get that going on that grassroots, basically grassroots level.
PRN certainly looks like it's got the infrastructure that's needed. Dr. Ehrman, can you tell us a little bit about your involvement in PRN and what successes your group has had this year as it relates to the public health crisis and how we're reopening too fast, and especially in regard to what you guys are trying to do to protect students and teachers and people in the work sector?
Yeah, I wish I could say more successes, but I think we've had an influence on both the city Is there anything I can do about the echo?
We're not hearing the echo. So long as the rest of us don't talk, there shouldn't be an echo
Okay.
that people are hearing.
Let me.
Maybe
hold on.
Kathy, can you mute your mic? I don't know if that'll.
I've got one too, G. See over here.
Oh, nice. I love it.
Um,
Um,
Oh, you might need to use your headphones again, doctor. Try that again.
Is this any better?
Much better. Yeah. We can hear you very clearly.
Great. So we have started from the beginning saying that the public health model is not rocket science. It's something that progressives, particularly women, did in the 19th century. And I'll just give you a few examples. 1850 was the first time we started opening schools for vaccines, both for students, parents, and community residents. 1888 is when Jane Addams and immigrant women from within a mile or two of the Hull House started doing door-to-door vaccinations with smallpox. In 1894 is when Florence Kelley and other women, including working with Ida B. Wells, began to take vaccine into the workplace to directly vaccinate workers where they were working, not telling them to take off from work and lose their job and go to CVS or Walgreens.
Mhm.
So our perspective is not coming out of our own, just our own experience, but coming from successes in Chicago, the United States, and around the world. We have had some positive influences on both the city's Department of Health and CPS, but not nearly enough. The positive experiences was getting the Department of Health to open up Chicago community colleges for vaccine centers, but then they hardly let anybody know about it. Getting the Department of Health to offer in-home vaccines, which is the only way the city is doing vaccines now since July 28th, but then the city offering it only Monday through Friday, 8 to 4, which means you should take off from work, lose your job if you happen to be working 8 to 4. And in terms of contact tracing, we had a very positive influence on the Cook County Department of Public Health, which affects the 2.5 million people who live outside the city and the county, to do contact tracing the right way by hiring contact tracers as public employees, getting $20 an hour with full benefits, and becoming AFSCME members for the county of Cook. We now think we've had some influence on the Chicago Teachers Union, though again, not nearly enough in terms of them calling now to open up 100 schools for vaccinations. And certainly some influence on the CPS, where several of our members have testified many different board meetings over the last year and a half to now say that all teachers and staff should be vaccinated by October 15th, which is too far away, in our opinion.
So, G, you are an educator, and Michelle, you are a parent to a CPS student. I would invite both of you to perhaps jump in here and share some of your thoughts on the importance of what Dr. Ehrman has just shared as far as proposing to the teachers union and the city, what should be done, how important this is in regards to what has to be done before we're reopening our schools for the fall.
Go ahead, Michelle. Parents are on the front lines of this battle, of course, to protect their children and their community. So, Michelle, you go ahead. I'll speak after you.
Thanks so much. Yeah, I think as a parent, it is very anxiety provoking and scary at this time. I think every parent can relate to that. I think that mandating us to go back in person is kind of a very top-down approach about what the district and government thinks is best for our children's mental health. And while that might be their opinion, we believe that choice is important as a parent. And, I don't want to make choices for other parents. I'm not their parents. I don't parent their kids. I parent mine. I have a 5th grader that's coming in and a 1st grader. And I just want a choice. It would be nice if parents want to bring their kids in, fine. But a lot of parents are scared and want to wait. We've waited 18 months almost. We've made incredible sacrifices to keep ourselves healthy, to keep our kids healthy, and having just that choice for the fall would probably be really beneficial. We've come this far. It would have been nice, in my opinion, to see more effort earlier on the vaccination. Because the more adults are vaccinated, the more my kids are protected. And I think everyone I ever meet, whether it's a neighbor to anybody that I'm in a Zoom call with, and I say, thank you for getting vaccinated because you've protected my kids. I've had concerns about the ventilation in my kids' school, and I know other schools are not properly ventilated and they're not checked. I know that the HEPA filters they have are not the most reliable, and that we might need more than one per square footage. And we're having more kids coming into those rooms. So it's not a big ask, in my opinion, if we have more HEPA filters and more room changes and figuring that out. Again, I also feel like it would be helpful to have a full-time nurse and a full-time social worker. Our kids are anxious. They don't know how to engage. They see another kid and there's this delay in socializing. It's different. And not all of us have been back. In my school, only about 50% have been back. So that's a big deal. And it would be nice if our teachers had some support, because there are going to be so many of them feeling that way. And on top of that, teaching them. And we know, as a social worker, I know that kids can't learn when they're stressed and when they're anxious. And we rely on our kids to feel safe by knowing what's protecting them. And if it's August 13th and I don't know the ventilation status of my kid's school, and I don't know if my kid's going to be on a computer screen or if my kid's going to be looking at a board, and I don't know where they're going to eat lunch. And I don't know if they're going to be outside more than once a day. And I don't know how many teachers are going to interact and what pods and what that's going to look like. That doesn't make me feel kind of calm to learn, right? And kids feed off of what parents feel. And I can try to trust, but my kids will need that too. They need to know that it's just not a sign and a sanitizing bottle. We need to know. In my kids' school, the sinks weren't working properly to wash hands. They might have improved that, and I trust that they may, but parents just want a choice and want to know. It's August 13th. This should have been done in April. We've been back in school. We've been making the same demands. They know what we want. And again, I know that some parents want their kids back in school, and I respect that, but some of us have grandparents and aunts that are immune compromised, and if one of our kids brings it home, that my father may pass. This is not just about me dying. This is about my aunts, my uncles, the people that help care for my kids, and then would make me have to pay for more support. What do I do as a full-time mom that works? If my kid has a cold, which, as we all have ever parented, we know kids go to school and they get sick. If it's not COVID, if it's a cold, I can't bring them to school. How many sick days am I going to take off of work? I have 2-3 weeks max. What if he does get COVID and I'm at the bedside for several weeks in an ICU, which can be quite stressful.
When you talk about the ventilation systems, one would have expected that all the federal COVID funds that came last year would have gone towards that. But I think that 70% of it, 80% of it went to CPD's budget. G, can you speak to, as an educator, what you know of how much money has been directed towards all the things that Michelle was just commenting on, as far as making it safer in the schools to reopen with some modicum of feeling like there's some protection? I mean, I also, before you answer that question, all of us growing up, we knew that kids had to be vaccinated when they went to schools for all kinds of diseases. And this resistance now, because of how the disease has been politicized, it blows my mind. You wouldn't go to your mechanic. I think it was comedian Bill Burr who said this. You wouldn't go to your mechanic and have the mechanic tell you, there are 4 lug nuts on your wheel that are loose and you probably shouldn't drive your car, and then respond and dismiss what your mechanic says, no more than you should dismiss what medical professionals are saying. But people in this country that think that because of what they hear on mass media that's politicized, completely usurps what medical professionals are trying to do to guide us towards the safe decisions to make so that we can come out of this. But sorry for my little filibuster there. Going back to the issue of budget and how much of the COVID funds that the federal government gave Chicago, can you speak to that at all?
Absolutely, Jerry, and thanks for having us on your show. Let's talk about the money, because you always have to follow the money in this, especially in this city. And I agree with Michelle that all of this should have been in place in April. But in fact, considering the science on pandemics, actually we should have, as a city, we should have prepared. As a country, we should have prepared 15 years ago, because the SARS we knew that this is an era of pandemics, and
we were warned. The research was there,
and all the documentation and the science were already in place. The city got $6 billion in federal COVID funds. $6 billion. Okay, so let's break that down. That's a huge number. So it's like I can really conceptualize only like a few $1,000s for me. But considering the science that we have as well as the funding that we have, it's like for the city of Chicago to have responded in its profoundly dysfunctional way. It really strikes me as a social experiment, like an epidemiological experiment, with our young people and our communities. And who among our the Chicagoans are going to be hardest hit? The same people, the same areas in our segregated city that's always hardest hit, the frontline communities in the south and west sides. So I also agree with Michelle and my cohort here that the city has to, really fast, immediately retrofit all the public schools if they're going to open them, immediately retrofit them as safe respiratory study sites, with all of the HEPA filters and at least 6 air changes per hour, although it should be more than that, and also arrange for classes to be outside. So just to break down that huge number, in between 1996 and roughly 96 to 2002, early 2000s, was the last major CPS renovations in Chicago. And those major renovations at its peak cost $500 million per year. At its peak. And we're talking about gutting and new, like the new plumbing systems, like really gutting buildings. So that's plenty to retrofit these schools, not only as safe respiratory study sites, but also as easily accessible vaccination sites for the communities, for the local communities. That just makes sense, right? Why these special contracts through CVS and Walgreens and so on, which is so problematic, and they're right with CVS and other drugstore networks, like in current legislation, in the legal process now with the oxycodone, the painkiller, that whole crisis.
Yeah.
So they're problematic. So and with that retrofitting, that architectural retrofitting, the remote learning has to be 100% accessible, which means, free laptops. City colleges did that. Other school districts, elementary and high school districts, issued free laptops. It's not difficult to do. Free high-speed internet. That's a huge issue, especially in, again, these same neighborhoods in the South and West Side. And, with these immediate actions and this urgency, we always have to keep in mind the long-term goal, because we have enough money to think long-term. We have to always think long-term. We should have started thinking about that even before SARS, but 15 years. But we have to think in that way, right? Because our planet is burning.
Literally burning.
Literally burning, right? So, I mean, I didn't mean to, I'm just in my kitchen. So might as well, Enbridge Line 3 is under construction, scheduled to complete by the end of this year. So the immediate retrofitting is totally doable with the HEPA filters and the panels that go up and, that's totally doable.
Yeah.
But the long-term architectural and the mechanical renovations really have to transform these safe respiratory study sites with clean energy for the long term, so that in the long run we have healthier communities that actually with high quality education.
Listen, before I bring Kathy Powers into the chat to talk about Northside Action for Justice, I think Dr. Ehrman had some things to share in regards to what you and Michelle were sharing with us regarding staffing, how CPS has not allowed unions and CTU to verify ventilation changes. This was coming through the private chat, and I know that these were important. Dr. Ehrman, would you like to add to what Michelle and G were sharing with us?
Well, I think what's really important here is all of us can see this now, that the Biden administration is as bad or worse than the Trump administration in the handling of this crisis. But as we all know, the CDC has very limited power. And so the vast majority of power, based on maintaining slavery at the time the Constitution was written, is in states' rights. So the governors, and in some cases the mayors, are the ones that have the primary power to deal with this pandemic. What the federal government did for the first time in US and world history is to make exclusive contracts with CVS and Walgreens, bypassing the state and local health departments, who had always done mass vaccination. It never was in the hands of private parties. As we know, Trump did that contract, but Biden not only withheld that contract, he went one step further to make things worse by bypassing local and state health departments in general and shipping them vaccines for anybody.
Doctor, don't you remember he said nothing would fundamentally change? Come on, Jack.
Right. And so I don't know if people realize this, but CVS and Walgreens have gotten hundreds of millions of doses free from our federal government, our tax money, and they make $45 to $174 a shot, whether the person's insured, have Medicare, or uninsured. So they have made billions of dollars off a vaccine that an African-American scientist at the National Institute of Health invented. The other thing I would just say about CPS and Michelle's important comments along with G's is that CPS and New York both bought machines that are not HEPA machines. They are not HEPA filters. They are not certifiable by ASHRA. That is the International Engineering Organization that certifies these machines. And they have refused to allow either the Chicago Teachers Union or SEIU Local 73 to verify their 1 to 2 room air changes, which is completely insufficient because it should be 6.
It's astonishing, but maybe not so astonishing when we know how everything's being privatized because of who's lobbying our legislators and without an eye on what's actually important or helpful to those of us they're supposed to be representing.
Yeah, if I could just comment,
Please.
that you asked me to. I think what's really critical right now for all of us is that everyone in this country who's a public commentator, with the exception of a few people, and this includes Amy Goodman this week, has taken up the rhetoric of the left and right anti-vaxxers to make people believe that the main problem are people resisting vaccine. Yes, those almost exclusively white groups are the ones that get on television, are the ones that get on the radio and in the newspaper, but they are outnumbered probably 100 to 1 or 1,000 to 1 by tens of millions of African American and Latinx frontline workers who cannot afford to take off time to get vaccinated. The president keeps saying, oh, please employers, give the workers time off with pay. That's not the way to do it. Like we said, Florence Kelley in 1894 took vaccine into the workplace. One of the worst capitalist companies, Tyson, has offered vaccine in the parking lots of every one of their meatpacking plants. But somehow the neoliberal governments of the Democratic Party in the White House, in Springfield and Chicago, don't want to do that.
I want to shift the conversation to one of our other guest panelists. Kathy Powers has been waiting very patiently. Kathy, I appreciate your patience. Want to bring you into the conversation also. And to reintroduce you, you're a board member of the Northside Action for Justice. Can you tell us a little bit about how Northside Action for Justice has been involved in teaming up with the Medicare for All organizers as well as PRN? And what your role is and your group's roles are as far as helping push these initiatives forward.
Well, Northside Action for Justice is a volunteer activist group, and we cover an expanse of Rogers Park, Edgewater, and Uptown, but we go all over anyway because the injustice of the system doesn't just hit our communities, it hits all the communities. And we kind of view the whole city as our community. So when injustice happens in housing, in getting food, in human services, I'm on the human services action thing. I'm also on the Chicago Community Mental Health Board. So I have a special insight into some of the things that the system is doing. So when we heard that the system was proclaiming everybody back to school, don't let your child fall behind, the schools are safe, we were livid. We were livid because we knew it was such a lie. We were going in such a wrong direction. You know, during this pandemic, especially now with the spread of an aggressive Delta variant among unvaccinated teachers, staff, and students, that assures needless illness and death. We've already talked about the old school buildings. I went and testified in front of the CPS board about Ehrman. CPS is going to hire Ehrman back to clean the school. Ehrman, which I did a lot of research on. I didn't even I knew they were horrible, but they were more horrible than horrible. They are connected to organized crime. But we have to remember that the mayor is running for re-election. So, you know,
she may not. She may realize she doesn't have a chance. We're all kind of like hanging on to see if she's arrogant enough to think that people are going to want to trust her again. But you're right. We have to wait and see.
Oh no. She's arrogant enough. She's cut from the same cloth. And she's making these backdoor done deals like with this error mark. Now, I don't know, because you don't know. You testify, and I sent in paper testimony too about what I found out about error mark. I don't know if they're even going to pay attention to it, because of course they're under orders. They're just they're like an army. Her appointed board. They want to keep their jobs. They're going to have to go along with whatever she says. And I just kind of pointed out to the board. I said, look at Airmark. Look what it does. If you think you can sleep at night by letting Airmark back in, then that's what you're going to have to do to keep your job, because I'm telling you, you're going to cause a lot of grief. Airmark for years they didn't empty the waste baskets, they didn't clean the bathrooms, they didn't do anything. The schools kind of looked like garbage cans. It was horrible. And they got paid, and so when I heard about Airmark, I said, I can't believe that they're coming back, because they did. When their contract ended, they hired actual janitors that were employees of the school. How good is that? That's good, because it's their community, and they have an investment to make things as good as they can. So now that's been kind of thrown out. I don't know what's going on with that, because all this stuff is done behind closed doors. We really, really don't know about the masking. I got to talk about the masking. First of all, mask students have to remove their masks to eat. And experts, warn that eating indoors can be dangerous even for vaccinated people in high-risk areas. Well, the whole state is a high-risk area. So, we're in a high-risk area. And there are no states that are at low or medium risk. I've been doing some more research. They don't tell you what kind of masks to wear. There's no adequate education about what kind of masks to wear. Cloth masks, they don't work well at all. For a cloth mask to even do anything at all, it has to have 3 layers with it. And then if you swap that out just with one of the surgical grade masks, the amount of safe time a person can spend in a room with someone with COVID skyrockets to 2 full hours. You can be safe for 2 hours with a mask. And we're talking about, having children in school full time. If they have a mask with an exhalation valve, that actually speeds up disease, because if the person has COVID and has a valve on and the air comes out, what they're breathing isn't filtered. It's not filtered. It defeats the purpose.
Let me also interject here too, and correct me if I'm wrong. All of you might have an updated number, but is it only 50% of residents in Illinois are vaccinated now? Is that the going number, or do you know if that number's changed? Because that's what I remember last reading. 50% of residents in Illinois were actually.
What I last read was they had at least one shot. That was what I read. So that doesn't even mean they're fully vaccinated. And let's think about who's fully vaccinated. Are they fully vaccinated on South Shore? No. Are they fully vaccinated on the Gold Coast? Oh, for sure. So when they do these numbers, they're not telling you specifically. Really, you're not getting really any safety information at all. You're just not. And like with schools, they say, well, if the child isn't vaccinated, well, we're going to test them. We're going to test them regularly. Well, suppose a person has COVID and they test them, but they test them like within 5 days. They don't know. It's not going to show up. It's biologically impossible to test children to safety. You just can't.
Kathy, I want to interject here. There's a comment in the live chat that actually spoke to something I wanted to ask all of my panelists, and we could potentially spend another hour on this.
Oh,
but I don't want to do that.
I see it right now.
But it comes to Allison Arwadi. And our commenter in the live chat says Arwadi was on TV talking about Lollapalooza, Deltapalooza tracing, as I'm calling it, practically crowing no spread from Lala, no vaccine passport mandate, no travel restrictions, no planned shutdown. I eventually want to bring our conversation back to Medicare for all. However, being that it's so important, focusing on what's happening with the health crisis here in Chicago. And I want to start with Dr. Ehrman. If you were in Dr. Arwadi's position, or if you had some influence on her, or if you had some influence on what's going on, what would you want to see her do? I sense so much of what's happening is political. She's enabling and making every excuse for the city of Chicago and the mayor to have allowed Lollapalooza to continue, all of these fast reopenings, these questions that we have about the reopenings of school. Dr. Ehrman, you have been appointed to replace Dr. Arwadi. What do you think needs to be done as a public health official to make things safer?
Well, I would say that there are people all over this country who are like myself, some of whom are younger, who know the right thing to do. It's, again, not rocket science. So immediately what would happen is we would immediately require masks to be worn by everyone inside anywhere. We would take all of our resources, including the billions of dollars that the city, the Chicago Department of Public Health, and the Chicago Public Schools have gotten, that's not millions, but billions from the federal government, and we would implement the ordinance that people on this call, meaning Joy and Kathy, Michelle, G is new, although we know each other for a while, wrote up that Alderman Byron Sicho introduced on March 23rd of this year. It has 13 co-sponsors, including 20th Ward Alderwoman Jeanette Taylor, who's been one of our people in the People's Response Network. And that has 3 pillars, all of which are based on 170 years of public health. Number 1 is that you open the schools in particularly the African-American Latino neighborhoods. And the first thing is that I think everybody probably knows, although maybe not the specific numbers, 60% of white people in Chicago are vaccinated, 45% are Latinos, and 36% of African-Americans. That's across the city. If you broke that down by class, by social economic status, it would be far worse for Latinos and African-Americans who are not middle class or above, but are the working class. I'm sorry. So basically, go ahead. Yeah, go ahead.
Well, I wanted to ask. There seems to be, from what I've read, and again, correct me if I'm wrong, there is a distrust in African American neighborhoods regarding the vaccination that might have something to do with the number of vaccinations being as low as they are. How do you convince? How do you assure people in these neighborhoods that are resistant or mistrust vaccines to listen to medical professionals, if that's part of what needs to be done?
Well, let me just finish to answer your first question. So the first thing is we would open up the schools in those zip codes, which are all African American Latino zip codes in the city, to be vaccinating people at least 12 hours a day, 7 days a week. That means anyone who walks in the door who's 12 years old or older. That's number 1.
They have to have the vaccine to go back to school. If they want to go in the classroom, they must.
Right. Nobody should be in any school on August 30th who basically is not fully vaccinated, which means 2 weeks after their last shot. So if they're an adult, they could have gotten the Johnson & Johnson vaccine. They only need 1 shot, but it's 2 weeks after they finish their vaccination. That's number 1. Number 2 is we would go and I want to explain who the teams are here. It's not just the Chicago Department of Public Health. The University of Illinois at Chicago, where I'm still on the faculty, is the largest medical school, nursing school, pharmacy school, and dental school in the United States. They have thousands and thousands of students, faculty, and staff who are state of Illinois certified vaccinators. they were all vaccinating in the U of I center at Racine and Harrison until they shut it down a couple months ago. So we would take all of those students, all the faculty and staff, and we would combine them with the Chicago Department of Public Health and the Chicago Public Schools, and we would set up these places in schools. Then the next thing we would do is we'd go into the workplace. So the OSHA, the Occupational Safety and Health Administration, came up with a very well done scale under the Trump administration in June of 2020 that rated workplaces by their risk for COVID. So I think everybody here knows what those are: hospitals, nursing home, meatpacking plants, farm workers. So those are the top four. And so we would send those teams into those highest risk places with the greatest number of people, and we would vaccinate people, going down to small places of 10 to 15 workers. This was done in 1894. The third thing we would do is we wouldn't spend hundreds of millions of dollars. I don't know if people realize there's hundreds of millions of dollars that have been spent by the federal government through the states and the cities to send very well-intentioned community health workers, a lot of whom are from the neighborhoods at highest risk, to knock on the door and tell people where to get a shot, or carry an iPad with them and tell people to get a shot. That is absurd. What they should be doing is going door to door with a nurse or another vaccinator and giving people the shot that want the shot. Now I'm going to answer your last question, which is a perception, in my opinion, and Joy should speak to this, and G and Michelle. This is based on racism. In other words, the idea that African Americans are less likely to get vaccines is a racist conception, meaning that if people from those neighborhoods were working as part of a team and you offer people the vaccine and you explain it to them, people would be just as receptive as the mostly white people who live in Kenilworth. But that's not what's happening. Instead, what happens is the city of Chicago opened up, I'll give you an example, a site in the parking lot of Kennedy King College, in the back of the parking lot, because they made a deal with a huge private nonprofit to give free testing. And that deal included, and I have the document on this computer I'm talking on, a memorandum of agreement with the Lightfoot administration that said that 2 policemen in their cars with their blue lights on had to be there at all times. Now, if you were walking down 63rd Street at Kennedy King, would you trust the city of Chicago to do a test or vaccine?
No.
If the Chicago Police Department was there with their blue lights on?
Obviously.
And so that place closed down in 3 weeks because nobody would come. This is what the city is doing. So in my opinion, the director of the CDC, Walensky, Arwade, and certain other people should be put on trial because they have committed crimes that have killed people. Dr. Walensky, on May 13th, in the last 3 months, has killed thousands of frontline African-American Latino workers by telling people to take off their mask. Arwade and Lightfoot are going to kill people because of Lollapalooza, Fiesta del Sol, and not enforcing masks. They still have no requirement for masks. LA County put a requirement in a month ago. So they're criminally responsible for what's going on. But I think Joy and other people, of color ought to really answer your question about why people seem to be hesitant.
Joy, please go ahead. I'd like to hear what you have to say.
Oh, thanks. There does seem to be a mix. I don't know what the polling is, but there are Black folks who took it, have taken the vaccine, and there are some Black people that are reluctant. I think what can help is more and more engagement with people because there are some people close to me who are resistant, and so I'm not going to be like giving them a really hard time, just trying to gently nudge type of thing and say, well, I got it. And I think that helps a lot. The more people who get it and people see that, oh, you're okay, you seem to be all right. And that I think helps gain more confidence in getting it themselves over time, hopefully sooner than later, hopefully, please. But of course, in terms of the Tuskegee experiment, that plays a part.
Yeah, I've heard that too.
And there are, unfortunately, still racial disparities in terms of that are happening today, such as the ridiculous myth that Black people can withstand more pain than than white people. And so sometimes we'll go in and, they can have, the education and everything, but not be given the same treatment as someone, someone who's white. It's like when my father went to the hospital for a heart attack at South Shore Hospital. They didn't put him on heparin, which I didn't know was a thing, except one of my friends from high school who's Black. She's a doctor. And I was texting her, thank God, I'm close enough where I could text her and be like, yeah, we're here. And I said, they put him on morphine. And she's like, morphine, what? She was like, what is that? She was like, talk about standard of care, which I wasn't familiar with. And I was like, oh, I guess that's a phrase. So yeah, all kinds of things like that make it harder for some Blacks to trust.
Well, we have an interesting comment from the live chat, and I also want to encourage everybody who's involved in the live chat. I like to advertise our Friday night broadcasts as interactive, but B. Ford shared with us, they're Black and from the South Side. They don't want the vaccination, and many people they know don't want it either. No one is addressing their true concerns, and I would ask B. Ford, what are your true concerns so we can understand this? I mean, obviously it's going to need to be addressed so we can get more people vaccinated. We have asked in the live chat to B. Ford, what are your concerns, but haven't gotten a response yet. But that kind of speaks to what I had initially brought up when I directed the question to Dr. Ehrman. And also I want to, again, encourage people in the live chat. You've got an amazing panel of people here. If you want to ask questions to directly, please post your questions in the live chat, and we'll try to take as many of them as we can as we're discussing these matters.
Real quick, I just want to say that when you see Regina Bunton, that's my mom. So.
Oh, okay. So B. Ford, their concern, and B, I don't know if you're male or female. That's why I keep referring to you as they. Please let us know if you want to. But the concern is it's not a sterilizing vax. And yeah, with the level of mistrust.
Maybe she could explain more. What does that mean? Not a sterile.
So I've heard people say that they're concerned that if you're of childbearing age, that if you get the vaccine, I've heard concerns that it can affect fertility. I think it's around that. I've heard women say that. I don't know if before it is a woman, but okay.
She's a woman, mom of three. Very fair. Look, it's a very fair concern.
Sure.
So I'd really like to really address B. Ford. Thank you so much for your comments. I think the first thing I want to say is that we all have to be incredibly respectful and open-minded at listening or seeing when somebody's writing their concerns, their ideas, and not in any way belittle them or think that it's based on false science or anything like that.
Of course not.
So I first want to really explain, as I think particularly the women, which is everybody except me and the host, know already, is that we have a major problem here of structural racism and colonialism that predates COVID for almost 600 years at least, depending on when you want to start counting. And the way that takes place is in particular the way it affects African American women. It was documented in the best documentary ever made on health and social determinants of health. And that was a 2008 documentary you can see online for $4 for 4 hours called Is Inequality Making Us Sick? In that documentary, they have one called When the Bow Breaks. And that's about an African-American 30-ish-year-old lawyer, six figures lawyer whose husband also makes six figures, walking around one of the nicest Atlanta suburbs, going shopping and eating from Whole Foods. And she has a premature baby, 2.5 months premature. So the issue of maternal and infant mortality and morbidity in particular has been going on since the concept of race and racism began, and particularly in this country. In fact, in the last 15 years, there's been a tremendous increase of African-American women dying who are pregnant or during pregnancy or within a few months after pregnancy, as well as an increase in premature births and deaths of African-American infants. This has nothing to do with genetics and everything to do with racism. This is documented. There is major hormonal disruptions of every hormonal system in the body. This is not just true of females or people who identify as females. It's based on how dark your skin is. My darker skinned cousins have had many more problems than I had going through life as a white male. So this predates COVID. What's happened since COVID, particularly around the question of becoming sterile and pregnant women, is an absolutely, again, criminal response from the federal, state, and local governments and health departments. We know, every medical student or people who take biology in high school know that the minute a woman becomes pregnant, her immune system becomes depressed. In other words, she is more vulnerable to any possible infection, viruses, bacteria, urinary tract infection, which, by the way, kills hundreds of women in this country every year unnecessarily, and certainly to COVID. So instead of the federal government through the CDC, our health departments, Illinois and Chicago, Cook County, and the American College of Obstetrics and Gynecology immediately saying that, yes, we didn't do almost any testing on pregnant women of this vaccine, but we know that the risk for dying from COVID is greatly, greatly increased if you're pregnant and you get it. So we recommend you get it. When did that recommendation come out? This week. The recommendation came out this week from the CDC, 9 months after the vaccine came out. There are very few commercials, PSAs, or anything else people have seen, although you can find them if you look for them, of women of color who are actually advocating. And now you can find these on YouTube and other things of doctors who are women of color who are pregnant, who are explaining why they got the vaccine, and other women who are pregnant explaining why they got the vaccine. This is too little too late. And so we have this thing going around, which anything can go around in terms of a rumor, that the vaccine is more dangerous to a woman of childbearing age or a pregnant woman than not getting vaccinated. And the opposite, of course, is true. But we can't blame people for thinking this because no one has spoken, truth to power. And that's where all this is coming from.
So B. Ford has another comment. It's not concern. They want to sell this vax. I don't think it's poison. It's a treatment, but not a vax. We're going to have a Zeta strain at this rate. Well, that speaks to the different variants that are emerging and the discussion about booster shots and how the medical industry is going to be making a lot of money off of what they're monetizing with the booster shots.
Well, I think, B. Ford, if you think about how hurricanes are named, we could go way beyond the Zeta or Z, right? Because as one of the greatest acts of imperialism by the United States, the European Union, and Japan, Russia, and other imperialist countries, until the people throughout Africa, in every country of Africa, Latin America, and Asia, get the vaccine, which they should have had from the beginning, then the variants are going to continue. But we have to know, and everybody on this panel knows, that colonialism exists in this city and in this country, right? And so the disease is being concentrated in Englewood, in South Shore, in Little Village, where I'm sitting right now in my home of 37 years. And so the variants are going to much more likely pop up in those communities, not just in India and not just in Indonesia. So this is another way, to quote Raoul Peck, that we're going to exterminate all the brutes. And so this idea that basically we are going to somehow get out of this by hoarding the vaccines, when we have the first director of the World Health Organization from sub-Saharan Africa, who is by far the best director. I mean, he's not perfect, don't get me wrong, who every day is telling the world, you've got to give us the vaccine, not just ship us the vaccine, but give us the right to produce the vaccine. Believe it or not, India, South Africa, Brazil, Indonesia, many countries know how to produce this vaccine. Until that happens, we don't know what's going to happen, but clearly things could get worse than they are now.
I would think there might also be a lot of distrust because of how people are seeing people like Bill Gates working with World Health Organizations to control the patents of the vaccine so that they can monetize them more, could very easily lend this mistrust of, well, this is all just about pharmaceutical companies making more money based on how they want to control the patents and then monetize who gets treatment.
Well, I think you raise a good point. I don't want to dominate now these answers. I just want to say that we have, this is another discussion if you want to have this. and that is the complete failure of the left to even analyze this problem, much less do something about it.
Yeah.
So we have people like Bernadine Doran publishing an article 3 weeks ago in the Monthly Review, the oldest Marxist journal in the United States, praising Dr. Paul Farmer, who is one of the leading colonialist doctors in the world, who basically, his chief patron is Bill Gates in the United Nations. The Haitian people took photos to prove in 2010 that the United Nations was responsible for killing thousands of people with cholera. I don't know if you ever heard about this, but they didn't dig latrines, and literally the soldiers went right into the drinking water of the river. The Haitians with smartphones in 2010 documented this, and it took 5 years for the United Nations to admit it. And Paul Farmer, who is a patron, he basically had a position in the United Nations. To this day, 11 years later, refuses to say that the United Nations was responsible for that. And he and Bill Gates are trying to control the entire health system of the world. What do I mean by this? Paul Farmer walks on water in terms of 99% of leftists and liberal Democrats in this country. Here's what Paul Farmer did. His partners in health that have never, ever worked inside the United States until this pandemic went and now have been taking over or compromising state health departments, starting with the state of Massachusetts, where they got the exclusive contract to do contact tracing, instead of the state of Massachusetts hiring contact tracers who were public health employees. Guess what happened? In a published article in the Boston Globe on May 15th of this year, they proved that Paul Farmer's people refused to take the hardest contact tracing cases, which means the people who are most likely working class, people of color, and they threw that back to the health departments, and they took the easy cases to do contact tracing. But guess where else Paul Farmer went? He got a big fat contract from J.B. Pritzker. Instead of Dr. Ezike, the health department, hiring contact tracers, they went ahead and developed a big fat contract tracing program with Paul Farmer. He's trying to destroy what's left of the public health system, and he's been somewhat successful at doing it without having any success in combating the disease.
I want to read from the PRN's demands, People's COVID-19 Response Demands. The People's Response Demands as developed so far cover the most urgent matters: direct relief for furloughed and laid off workers, moratoriums on rent increases, evictions, mortgage payments, fees, and student loans, free laptops for all Chicago public school students, immediately offering lodging to all houseless in 1887, currently vacant public housing units, decarceration, and more. The demands also focus on the public health infrastructure priority: immediate reopening of the 6 mental health clinics that were closed, full staffing of all 12 clinics, a full-time registered nurse in every Chicago public school as soon as they reopen, prompt and distribution of all personal protective equipment, medication, and equipment to hospitals and health clinics equitably based on Black and brown communities being at highest risk, place Department of Health personnel in every open business and public facility to enforce clear and strict orders for PPE, physical barriers, and social distancing to protect workers and customers. And crucially, the city must hire 1,000 Chicago Department of Health public official health workers, recruiting from and employing them in Chicago community areas with the greatest health and economic inequality. These workers would carry out door-to-door testing, screening, tracing, education, and referral for ongoing treatment as soon as proper PPE is available. Train, certify, supervise, and deputize the thousands of retired health worker volunteers and health science students to become health department workers to be deployed in the hardest hit communities. How do we get the governor and the mayor to pay attention to this? Obviously, you already are making extraordinary efforts, but what is going to get, I mean, aside from talking about it on social media, doing shows like this where we can get this information out to those that find our broadcasts, what are the next steps to get the mayor or the governor to implement what the People's COVID-19 Response demands? Hey, all of you, if you want to jump in here.
Well, that's a very good question. And we haven't finished our plan in terms of getting more and more people aware, because I think a lot of it has to do with getting more and more people engaged, more and more organizations, a lot on the grassroots, people on the ground, educating each other and organizing to have move for effective change. One of the things we're talking about doing is virtual screenings of documentaries to help, get people's engagement and attention.
Sicko. I remember you talking
Yes.
about in the emails. Yeah, that's a great documentary on
Yes.
the public health crisis.
Yes. Yeah, so we're talking about doing that in terms of just Medicare for all, as well as in terms of the public health aspect. And another one we're talking about screening is cooked survival by zip code. It had to do with the heat wave that Chicago had. I forgot which year it was, and how from what I remember, a lot of Black people, in poor zip codes ended up dying. It was just terrible and just so tragic. And we're also talking about the screening the documentary that Dr. Howard talked about earlier, which was, what is it again? He knows the name better because I haven't seen it yet.
Is inequality making us sick? Yeah.
Yes, thank
Making
you.
us
Is
sick.
inequality making us sick? Yes. And we also, in terms of the Medicare for All March side, are planning on screening the Power to Heal, which we already have a tentative date, which is the weekend of Labor Day weekend, from Saturday to Monday. It'll be available for people to stream for 3 days, and then we'll probably have like a Q&A or discussion on Monday. We're working on all those things to try and come up with, and hopefully the more organizations I get on board, then we'll be able to better plan and coordinate actions. Like I plan on doing outreach to my state senator is Robert Peters. And so I think he probably would be interested in helping us. I just need to connect with him. And I already have a contact from organizing the march with Martin Ritter of CTU. And so I sent him the flyer, and I believe he went ahead and distributed that to members. So hopefully we can do more, just do more and build and build and build.
I think the awareness is so important and helpful, Joy. But again, I think that getting our local media, our local news stations to cover this kind of stuff is how do you hammer them over the head? I mean, they're reporting on the public health pandemic, and you have the occasional stories about but the Medicare for All March, I think only WGN covered it, right? I mean, it's just not a priority when it affects so many people. 70% of Americans want Medicare for All. Bringing the conversation back to Medicare for All, and the People's Response Network, which I know that PRN is local, but are you also is the PRN also associated with other organizations nationwide as it relates to the response to the COVID-19 in other cities, or is it primarily here in Chicago?
Well, for the first 6 months of the PRN, we had a national meeting every week. We just unfortunately don't have the capacity to keep that going. So we do have contacts with different people. For example, teacher union caucuses in New York, Los Angeles, and other places. We just don't have the capacity to do that. We do support other efforts. For example, there is major efforts, many different coalitions exist to try to get the United States and other governments to share vaccine and vaccine patents with other countries. So obviously that aligns perfectly with us. I just want to say, I think that the politicians and the elected other officials are not going to move until we have a major mass movement, in this case, of parents like Michelle and people who are teachers in not just public schools, but also community colleges like G, to basically then force people to do this. So starting tomorrow, we are taking our latest flyer with our latest 10 demands about schools in particular. And we are dealing with a huge crisis that almost nobody has heard about in the city of Chicago. And that is that the Cook County Assessor's Office issued new assessments for the West Chicago Tax District, which is the largest tax district in the city that is populated by African Americans and Latinos. That includes my own home in Little Village. What's happened is that the assessments of the values of the houses have gone up 2, 3, 4, up to 10 times in 1 year. The Cook County Assessor's Office is giving us literally 3 weeks from the time we got the new assessment to appeal that, which is a very complicated process.
Yep.
So what's happened in response to this is that our primary political ally, 25th Ward Alderman Byron Cicho Lopez, and we got our alderman, Mike Rodriguez, to do this. We're hosting events with a sister organization, Pilsen Alliance, that is a member of the People's Response Network, and me, the Neighbors. And so we're hosting events to help people basically get an extension or appeal their tax assessment. The news just came out yesterday about the dramatic drop again of 100,000 African Americans in the official census between 2010 to 2020. That is on top of 200,000 less African Americans from 1970 to 2010. The same thing now has begun to happen with Latino populations dropping in the last 5 years. So this is going to be one of the most incredibly challenging things to stop gentrification, because we already have people on our block are getting ready to sell their homes because they can't afford this property tax. So what we're doing specifically is that we're going to be flyering thousands of people over the next 2 weeks, both in these events that are being hosted with the Cook County Assessor's Office and in every one of the 200 plus CPS schools that is still giving away food. We can't do this. We're not going to be able to do this on our own. We need thousands of parents. We need some of the 7,000 CTU members who voted against going back to school in February. We need members of SEIU Local 73 to rise up and to tell the leadership and the mayor and CPS and CTU. There's a phrase in Spanish called "ya basta." That's like enough. We're not going to take this. We're not going to have schools reopen as long as they're not safe. So that's what we're doing. And I think it's not going to be easy, but I think it's the only way to go. And the last thing I want to say is that we all got up, our ancestors, 3.2 million years ago at least, all started walking on two legs somewhere in Tanzania, Kenya, or Ethiopia. And the most important primordial DNA that we have is to protect our children. The majority of African American and Latino parents in this city, if Delta, and it will, continues to get worse, and they read about the fact that the growing number, the greatest number of infected people are youth and children, will not send their kids back to school. They are going to fight to make schools safe. We can't do that for them. They're going to each have to make their own decision, but we believe and we are confident that's what's going to happen.
Look, to our viewers, we have a doctor, an educator, activist, organizer, parent, all shouldering the burdens and the hard work. But as Dr. Ehrman just said, they can't do it alone. I would like to ask each of you as briefly and succinctly as you can, and I'd like to start with G. What can our viewers do? I mean, you're obviously, you guys, gentlemen and ladies, all have a support network within your organizations. But last week I had this remarkable young lady on, Melissa Hernandez, who is an activist, and she's raising money to get like portable showers to help homeless people with the outreach organizations that she's one woman, and she's doing it. And the reason I had her on was I was so inspired by what she's doing. You know, one of the things I'm getting tired of doing on this show every Friday night is coming on and bitching about what's not happening by reading the news. So when you see someone like Melissa Hernandez, who's doing it as an inspiration, beyond my panelists here, what do you tell our viewers what they can do themselves to help your efforts and to help in this insurmountable challenge to hopefully reach some kind of success? G, can I start with you?
Sure. Thanks, Jerry. And thanks, everyone. I learned a lot just from listening to each of you. My answer to that is that grassroots organizing is our only hope. I want to go back to something that Joy said about people, in these communities. We're in community. We're social animals. The legacy media and our colonial government officials, unfortunately, have failed us. They continue to fail us, so it's always been grassroots organizing. And unfortunately, our unions and our more institutionalized organizations on the left are very weak.
Failing us. endlessly failing us when we don't expect that they could do that.
So definitely, what Joy said, talk to the people you know, but more importantly than that, more importantly is to organize and to join with others. It doesn't have to be institutional, but we really have to build a huge grassroots movement, because we can't expect our leadership to represent us in this work, in this incredibly urgent work. Just like with the pipeline stuff going on, which is also a public health issue, grassroots organizing is our only hope. Thank you.
Kathy, your thoughts? What can our viewers do? How can they participate and do more to assist what you and everyone else on this panel is undertaking?
First of all, they're watching the show and they're hearing things, okay? What I want to point out is that we all care, and we're not alone. And we need to join together because there's strength in numbers. And don't be afraid because fear is actually the boogeyman here. It's not the administration, it's fear. Don't be afraid. Connect, network, talk to people. Just call me, email me, do what you want, because I love talking to people, and I'm all about people. We're all people. And let me tell you something. The legislature, they're not people anymore. They're corporately owned.
Yep.
So remember that. They have their corporations feeding them money, which is, I guess, all they're interested in. And we are here to survive. And we will survive together. Don't be afraid. We're going to do it. And listen to Dr. Howard, because he's marvelous.
I've had this crazy...
He hates that when I do that, too.
I've had this crazy idea and wondered if there's a way for the people of the United States of America to form their own corporation so that we can hire lobbyists to spend more money against the lobbyists that are controlling our elected representatives. It's not a crazy idea if you fight them back with the same tactics, but it would probably take an extraordinary amount of effort or figuring out how to do something like that, as crazy as it sounds. But let me move it to Michelle. Please share with us what your thoughts are on what our viewers can do to help and all the good work the rest of you are doing.
Sure. Thanks for having me. It was wonderful being here and listening to everybody. I really want to speak to some of the parents. I saw before say she wants a plan and that she's worried. I think parents need to stand in solidarity with each other. I think we need to not be afraid, as Kathy said. It feels like you're losing a lot, but you're not when you take up space. Because every time you take up space and you ask for something and you demand something and you request something, you inspire somebody else. So even if it's just your neighbor, a fellow parent, anytime, that's a big deal. It may not feel like it, but it really is, because then you light somebody else up, right? I was reading about grief work, and one of the first things you have to do is recognize, a loss, both the primary and the secondary losses, right? And then you have to make meaning and move through it. And Kathy's inspiring, Choe's inspiring, G's inspiring. You make meaning through that, through feeling that fear and that loss. Parents are scared, but we can stand together, right? We can say we demand remote learning. We're not asking for a lot. This is our schools. We can take up space and say that and not be afraid of the pushback and not be afraid of people saying, how dare you, right? Are you an activist? I don't know. That's too,
You're damn right we're activists, and you're damn right we're radical. You need to be radical to get any kind of movement.
We have to be in solidarity with one another because we all want the same things. We want our schools to be robust. We want them to be beautiful places where the community can flourish, where our families can flourish, where we can be employed, we can trust. And it's like a small family. It's a community, is everything. So it's okay to, push our leaders to what we want, So that's what I would say is solidarity, and don't be afraid. Recognize that fear and that grief and move through it and make meaning of it.
Thank you, Michelle. We seem to have lost Kathy. I don't know if she's going to reconnect, but I wanted to thank her for joining us tonight before we continue on with everyone's thoughts for our audience. Dr. Ehrman.
Well, like I wrote in a private chat here, it's no coincidence that 4 out of 5 of us are women, 3 of whom are women of color. I think the people most directly affected by every one of these crises that are all increasing and coming together, not that they've ever been separated, because they never have, whether it's the economic crisis, the rising crisis of racism, climate change, COVID. Not only is it women, and particularly women of color, who are most affected, but they're the ones who are providing the leadership. And I think that's what's really key here. I'm not here primarily because I'm a physician. I'm here primarily because I'm a father and a grandfather. And we have a big problem. We have a 4-year-old granddaughter in Wisconsin who's supposed to start school in 2 weeks. And we're having daily conversations with my son, her father, and with her mother about what to do about this. This is not easy. And I totally empathize with everyone talking about the emotional cost of kids not being in school, because that affects my 16-year-old and 13-year-old grandchildren who are CPS students, just like Michelle's, family and children, and G's work as a faculty member at Chicago Community Colleges. And the only way out of this is that we have to not only talk to people we already know, but lots of people we have never met yet. We have to talk more to our neighbors as long as it's warm enough to safely stand outside. We got to go to every school that is giving away food, which are over 200 schools in Chicago, and listen to those parents, listen to their concerns, and share with them our ideas and say, hey, we don't have all the answers. We want to hear from you. That's the only way things are going to change, because this is not going to get better until that happens. It's only going to get worse. And the last thing I'll say is that one of the most important studies that came out in terms of G's work on line 3 came out 2 months ago. And it was a study published in a peer-reviewed journal, and it said what's going to happen if we either have a heat wave or we have what happened in Texas in terms of freezing temperatures and the electricity goes out. So that's something we don't want to imagine, but that's something we better start working on together. And so schools, for example, are the best places to have as sanctuaries for these kind of things. And that's the kind of stuff we're going to have to do. So our group is already started beginning to talk. And we say this to everyone, whether you're a parent, a student, or a community member. We're going to put together a people's program to run for local school council in April of 2022. And we invite everyone from every neighborhood to join with us.
Might I also add, before I move on to Joy, everything that the rest of you have already said about organizing and sharing and talking is as relevant to the situation locally with the COVID-19 response as it is to Medicare for All, which was the umbrella under which we were all assembled tonight to kind of talk about those efforts moving forward, as the PRN is also involved. But I also think that everything that's been shared here, as far as how do we push our representatives into taking action on behalf of us instead of the lobbyists and the pharmaceutical companies and the insurance companies, to give people the kind of health care that's going to give them the umbrella coverage over everything that we're dealing with right now in this pandemic. It's just as applicable. Joy, let me bring it back to you. What do you tell our viewers that they can do to help everything that the rest of you are doing?
Well, hopefully they can reach out to me, for one thing. Reach out to People's Response Network or me in terms of Medicare, March for Medicare for All Chicago, because we need to get that grassroots going. I had gotten Rainbow Push Coalition on board for the march, so I'm going to be reaching out to them to get them on board with this. I wasn't able to connect with anyone at Trinity United Church of Christ, but I'm going to keep at it, because a lot of times what it is, just keep at it, trying to get a hold of somebody. So we need to get the churches. Definitely, of course, gotta get churches, especially with Black, probably brown communities. And we're going to we had someone from Illinois raise her hand, and so that's a lot of parents right there at our last meeting Wednesday. And so we're gonna try and set something up where we can get more of them, working with us and less with them. And so, all that, just building on top of that. So real quick, I just wanted to say that I'm fully vaccinated. And my mom, who's the Regina Buttons, she's fully vaccinated and she's 83. And so far we're okay, but I have I'm high risk as it is. And so I'm going to need the third shot because my spike protein antibodies are low. And so it's, people need to consult with their doctors, hopefully, and get as much actual information and talk to people who've gotten it. I think that'll help, and consult, find people like Dr. Ehrman and other trusted people who are on top of things and know what's going on and will tell you the truth. But basically, I knew that the vaccine wasn't going to cure it, or that it didn't mean that I wouldn't catch it. Well, probably haven't. But it basically means that I'm less likely to die, less likely to go to the hospital. And so that's the thing with the vaccine. It doesn't mean that poof, you're cured, you're never going to catch it. Just like the flu, you get the vaccine, that doesn't mean you never get the flu again. And there's different strains with the flu. So it's very similar. I'm not a doctor, but my understanding is there is that similarity anyway in terms of strains. And I'm hoping we don't have to keep doing the different strains like we do the flu vaccine, but who knows. But yeah, I'm just putting that out there to help, talk to my peeps about the vaccine from my point of view, and someone who's high risk, because I have mild interstitial lung disease. And so my doctor was like, don't leave the house. And I definitely wear a mask. Even when I'm fully vaccinated, if I'm indoors somewhere, I'm wearing that mask. Sometimes I'll wear it outdoors. So please be careful, everyone. And I have the KN95. I don't just do the cloth mask. I do the high, more premium mask. So thanks.
It's a courtesy and a respect. I mean, I'm vaccinated. I still wear my mask when I go out to let people know, hey, I respect the fact that I don't want to potentially expose you to something, because even as somebody who's vaccinated with this Delta variant, if I catch it, I could pass that to you. That's what it's all about. It's about empathy and thinking for other people. Gee, can you share information on the Raise Your Hand parent session meeting that's coming up?
Sure. Speaking of organizing, anyone could go to the Illinois Raise Your Hand website and just hit the get involved tab, and there are a bunch of things happening. Monday evening at 5 p.m. Central Time, there's a parents listening session, and that's exactly what it is. It starts with listening to each other, maybe relearning how to listen to each other, and just really taking seriously with compassion what people are going through and what the issues are with this impending fall semester. School year for CPS. So that's IllinoisRaiseYourHand.org. So that's ILRaiseYourHand.org, and then just hit the Get Involved button, and you should find information about that.
Kathy, any upcoming events or meetings that your group has coming up, Northside Action for Justice, that people should know about?
This weekend we are having a tabling, having people sign things. Alderman Kappelman has made an arrangement with the owner of White Hospital. Listen, we could do a whole show on that.
Kappelman, yeah, we could do a whole show on Kappelman. And you know what, Kathy? Perhaps we will. But go on.
Oh, good. That would be really good, because we have a lot of really smart people about it. And what we're doing is we have these postcards, and we're talking to people at Target in Uptown, and we're telling them, because people don't know about this. Yeah. People don't know about this. I wrote for it in the People's Tribune. I could send that to you if you want. You could look me up.
Everybody on the panel, really quickly, send me links for everything that's coming up, because I can update our show notes down there so that when people hear about this at the end of the show, they can also click through and find all this stuff. So,
I
not
wanted
right
to
now,
say
but we're, yeah.
something about Medicare for All. I really did. I'm on the Illinois Single Payer Coalition, and we have noticed that there is a big swing toward Medicare expansion. And Medicare expansion doesn't mean Medicare for all. That means Medicare for some. And we want Medicare for all.
Yep.
And it's disturbing to me because it seems to me, first of all, insurance companies will still be involved. If it's Medicare for all, it's the government that's going to be paying. If it's Medicare expansion, we're still going to be dealing with the insurance companies that are eating our lives. If we get COVID, we'll get the shots free, we'll get the testing free, but when we go in the hospital, we're going to come out with multi-$1,000 bills, hundreds of thousands of dollars bill, and we're not going to be covered. We're just not going to be covered, and we're going to have to go bankrupt. That is why we need Medicare for all.
Yep.
All. So that's all I had to say, and I'm sticking to it, Jerry.
I'm so glad you're able to join us tonight. Michelle, is there anything coming up with parents in your community that people should know about that they can participate in?
I usually follow Raise Your Hand. There's also a great organization that is the CPS Stick Out parent group that I think have posted alongside with them, and they're very useful. So I try to do that and get some. I think some parents are pulling their kids out of school, have decided, or maybe absent on that first day. There were a couple stick out days last year when parents were concerned about teacher safety and the remote and hybrid plans. I think I hear a lot of parents still wanting a choice and a possible hybrid or remote option just until we get over this. So I'll be following them and deciding with my husband what we can do and doing the best I can until then. But it's August 13th and school's starting in 2 weeks, and I still don't have a very clear vision, but I'm patiently waiting as I research masks and uniforms and possibly homeschooling plans all at the same time.
It's a challenge. I've got a sister who's got 3 little boys, and the oldest is 12. The youngest is, I think, 5, and the middle one is 8. And, what I constantly hear is, she's an attorney and she works really, really hard, and she doesn't have, her husband works. And I don't want to say parents rely on school to be daycare, but when they have jobs and responsibilities, it's obviously easier for the schools to open so the kids can go to them. But that's not acceptable. And we have all these questions lingering and things that are not being done to protect not only the children, but the teachers and everybody else. Dr. Ehrman, anything coming up with the PRN that you want to share with our audience?
Well, just what I mentioned, and that is that we, starting tomorrow at 9:00 in the morning at Harrison Park, Wood and 18th Street, Mi Vita Neighbors and Pilsen Alliance, who are 2 founding organizations of the People's Response Network, are working together to co-publicize these 2 events regarding trying to break down the silos. We're going to be really interested to listen to a lot of people, not just hand them our flyer, as G was saying. So we're starting to do that tomorrow. Then starting Monday, one by one, we're going to be going to a different school every day, Monday through Friday, starting in Pilsen Little Village, and we hope to branch out to other neighborhoods, but we want people from those neighborhoods to take the lead. If they invite us, that's great. We're willing to go. But we're not going to be going to other people's neighborhoods and flyering. It's important for people from those neighborhoods to listen, to figure out if they want to do this with us. So we don't have a lot of time. As Michelle said, we have a little more than 2 weeks from Monday is the day that school is supposed to open. And we think that the first thing that has to happen is for the parents, thousands of them, who want the option of remote learning, to have that right to have that option. That's first and foremost. That's why Raise Your Hand had a major press conference on Wednesday, which we support. And that's got to be done in the next couple of days. So that's number one. Number two is because of the work of a lot of groups in our work and the CTU's work, I hope the school system announced a few hours ago that all people working in the schools, teachers and staff, will have to be vaccinated by October 15th. We think that should have been probably September 15th or 30th. But anyway, that's a positive step in the right direction. The next thing that has to happen is for every school to get a nurse, to get a counselor, to get a librarian with the $2 billion that CPS has but doesn't want to spend because it wants to use it and throw it down the black hole of its debt as opposed to using it now to save lives. So those are some of the things we're doing. But basically, it has to be a lot of new people getting involved, and particularly the parents, the students, the teachers, and the staff.
The strength in numbers. Joy, the organizers for Medicare for All, has there been any thought in collaborating with those that are organizing the general strike in October to also further the agenda with Medicare for All?
There has been some on the national level, but in terms of Chicago, we're concerned that it came about kind of soon, and usually with strikes, they're usually the last resort, and so there is concern that there aren't enough resources that we will be able to provide in case, to give the people that we would like to strike to have confidence in striking and that they'll be able to still pay their bills, because usually they have to. I was told by Mike Patino, one of our March organizers, he's a union guy. He was telling me how usually they're asked to like save in advance for months just in case, because you never know how long it's going to go. So we'll probably help promote it, but it's.
Yeah. I wasn't expecting the Medicare for All organizers to organize the general strike. I'm just wondering if there was any possibility for an alliance there, because, and I have to look into the groups that are going to be calling for the general strike, as it might happen in Chicago also. I don't know that they're planning for it to be long term. I mean, even 2 to 4 days of impact would demonstrate, if it was coordinated across the country. And, a big component of that is healthcare for everybody, not just a fairer, higher living wage. But listen, I invite all of you. Go ahead, please.
Oh, thanks. Yes, I do believe it would be good to reach out to them and try and coordinate things because I do appreciate the fact that on the list of demands is like Medicare for All or universal health care. And so I definitely would like to, reach out to them, get contacts, especially at the local level, and hopefully we can help coordinate stuff in the future.
I'm going to
get it bigger. Go ahead.
I'm going to look into trying to find out who is coordinating and organizing here in Chicago for the general strike, as it might align with the national general strike. And if I can find out, what groups are coordinating that, I want to have them on the show, and maybe, we can do introductions too, because it's all connected. They're all connected.
Yeah.
As I mentioned a moment ago, you're all welcome to come back anytime with whatever you want to share with our viewers. That's what Chicago Corner is about. It's about sharing neighborhood news, and it doesn't necessarily all have to do with COVID response. If there's other things within the school system that you ladies would like to come on and talk about, Kathy, other initiatives that Northside Action for Justice is involved in, please reach out to me, Dr. Ehrman, anything regarding health issues. This has been a really phenomenal panel tonight, and I want to thank our viewers for staying with us. We went a little long, but I think it was very valuable and worthwhile to spend this much time talking about these issues as they're related to the pandemic and healthcare for all. And I want to tell our viewers, if you enjoyed the show, starting here, share this show with your friends, this particular episode, because as we're talking about how you get the awareness out, look at the marvelous informed panelists we had tonight to answer questions from our viewers, and help dispel fears and myths, to help advance this agenda of covering and protecting everybody, whether it's Medicare for all or it's just responding to the public health crisis that affects our students, our workers here in Chicago. I want to shout out and thank all of you for spending the time to join me tonight. Viewers, please like and subscribe, share the channel, share this particular broadcast. If it's happening on the streets, you'll hear about it here on Chicago Corner. I hope everybody has a safe weekend. And once again, I am saluting all of you for coming onto the show and spending time with our viewers tonight. Thank you.
Thank you, Jerry. Thank you, Joy.
Thanks, Mom.
Everybody else.
Sure. Thanks, everybody. And Mom.
Have a safe weekend.
What a great panel. This was really
It was.
good. Yeah. Network. And get vaccinated. Get vaccinated.
Yes, please get vaccinated. Wear good masks.
The last 2 words, get vaccinated.
Yes.
Thanks, everyone. Chicago,
Thank
stay
you.
safe.